Let's discuss this further now with Professor Cheryl Cohen from the NICD, that's the National Institute for Communicable Diseases. Prof, good afternoon. Welcome to today. Thank you very much for your time. My first question, how likely is it that we'll have a sixth wave?
So good afternoon, and thank you for having me. I think COVID is a respiratory disease, and so we don't expect it to disappear. The same as flu and other respiratory diseases, probably we know that COVID is going to be here to stay. So in terms of how likely is it that we'll see an increase in COVID at some point in the future, that is very likely, because we know that you can't be completely immune to COVID and it continues to change. But I don't think at the current time there's really no suggestion that a sixth wave is imminent. In other words, as the minister said in that clip that you've just played, the levels of COVID are really at an all-time low, and they've remained consistently stable and low for the last several weeks. And so at this stage, we aren't really seeing any worrying signs of a sixth wave, although we continue to monitor, as was mentioned in your clip. But we do expect that there will be an increase at some point in the future.
Okay, so we just have to look out for the caseloads that if in case they move up. Second question, if it does happen, will it be as mild as the fifth wave from indicators that you are looking at as scientists now?
Yeah, so that is the critical question. And of course, with COVID, it's very difficult to predict anything. But I would say that all the indicators suggest that South Africa is in a good position in terms of having a milder wave. And the reason for that is that currently we have very high levels of immunity in our population. So over 95%, about 97, 98% of people, when you test them, have some evidence of immunity to COVID. And that can be acquired from having had an infection, or from having vaccination, or from having both of these. And so because we have these very high levels of immunity, we know it can't completely stop transmission, but we do know that immunity substantially reduces severity. So that when we do have an increase, it is likely that it won't be as severe as those early waves that we saw before.
You say that
being said,
yes.
Yeah.
Yes.
No, carry on.
I said you say that. So sorry, Prof. You say that it's likely to be mild, not severe, because of the various factors. But what else can be done to make sure that the impact is even further reduced?
Yeah, so that is the critical point. When we talk about it being mild, we mean on a population level. In other words, the hospitals won't be full of patients. But it doesn't mean on an individual level that each of us are protected. And so it really is important for those people who haven't had the vaccine to go and have the vaccine. And if you're due for a booster, and many people are coming due for their booster vaccinations now, to really get that booster, because COVID still remains a severe disease. And there are individual cases, even in the last wave. I know people personally who were very sick and still have lung problems as a result of that infection. So it doesn't mean COVID is going away, and it doesn't mean that you can't get a severe infection. So really the most important thing is to get that vaccine to protect you against severe disease, and particularly for people at highest risk, elderly people or people with underlying illnesses. But really everyone we know with COVID can have a severe illness, and so everybody should be getting their vaccine.
Yeah, but our vaccination rate is very low, especially among the younger people in our population.
Absolutely, and that is a challenge. It's interesting. People take their children to be vaccinated, but it's much easier, much more difficult to get adults to vaccinate to protect themselves. And I'm not sure what that's about, but I think we all do need to try to do everything we can to protect ourselves. If an adult gets severe COVID, you can't look after your children. You might have chronic health or lung problems. So I think there are many efforts by Department of Health and many other groups to try to increase vaccine uptake, because you're right, the uptake is too low, and people should be using these vaccines, which are effective.
Okay, now in terms of it's not imminent, the sixth wave. In terms of the numbers, you said they've been declining each time you are monitoring them, but you're no longer publishing them. We don't see them like we were just a few months ago, giving a daily updates. But can you just give our viewers a sense about the trend of the decline? Is it a sharp decline? Is it a gradual decline?
So we do publish the data, but right now we publish it weekly instead of daily. We used to publish it daily, and daily was always a problem because, for example, on weekends, less people get tested, and during the week, more people get tested. So it gives you these fluctuations that are not a reliable trend. The weekly data really is the reliable trend. And in fact, COVID right now, it's not going down. It's at a low level, and it's remaining stable. So for about the last 6 to 8 weeks, COVID has remained at a consistent, stable, low level.
What does that mean? What does that mean?
Circulating.
Yeah, sorry, Prof.
Well, what
does that tell you,
yeah.
that data, if it's stable at the same level, what does it mean?
So it tells us there is COVID circulating, and that's why really people should get vaccinated. But it's not enough to take off. And the reason it's not taking off or going up is because we have a lot of population immunity, and because there's sort of a balance in terms of the immunity and the mixing and the strains. And so COVID is around. It is a possibility, but it isn't going up. And I think that was in the minister's address, right? One of the most important parts of our monitoring is the genomic surveillance, where we continually monitor and sequence the COVID strains so that if there should be a new variant that is, for example, more infectious or escapes immunity and could potentially then lead the cases to go up, we detect that early and we can take appropriate action.
Yeah, just a final question from me. Thanks, Prof. Vaccinations, vaccines. I've done the 2 Pfizers plus the 2 boosters. My last booster was in June this year. And we hear and we read that these vaccines are only valid for a short period of time. Do you anticipate, or should we anticipate? I'm asking you, you are the scientist, should we anticipate that we might need more vaccines or annual COVID-19 vaccines, like the flu jab?
Yeah, so that is a great question, and really well done that you've had all your doses, because that's the way we should all be. I think currently the data suggests absolutely that is likely to be the scenario for COVID in the short term. So in the short term, we know 2 things happen: immunity wanes and the virus evolves. And that is very similar, as you've said, to flu. And so most likely we are looking at a picture of something similar to annual vaccination. But the global community knows that annual vaccination is very difficult and expensive, especially in countries like South Africa. And so there's also a big push to make newer and better vaccines that will last longer and protect against different strains. That push is probably in the medium horizon, though. It will probably take a number of years before we get those better vaccines. And so until then, most likely, and this is being discussed right now, the scenario will be one of regular vaccination on, for example, an annual basis. And really to highlight, there is overwhelming evidence that even if you've had COVID, having a vaccine provides substantial, measurable, increased protection against severe disease and hospitalization, which is really what we're trying to prevent.
Thank you very much for your time this afternoon on Today on eNCA. Professor Cheryl Cohen from the NICD, that's the National Institute for Communicable Diseases.